Good morning. We just wait for a couple of minutes for folks to join us. We see the numbers are climbing slowly. Welcome, colleagues. If you are new here, you are in the right place. Do not worry. We'd love to know where you're joining us from. You can put it in the chat. Morning. All right. We've got a lot to discuss this morning, so we just kick off. Welcome, welcome, welcome. I hope you're keeping warm wherever you are. I am Elizabeth Baini, Research Specialist at Ilifa Labantuana, and I'll be your facilitator for today's discussion. You are warmly welcome to the Early Childhood Systems, Perspectives, and Research webinar series. This is a joint initiative of Ilifa Labantuana, Research on Socioeconomic Policy, that is RESEP, at Stellenbosch University, and Data Drive 2030. Our aim is to explore the latest perspectives and research and data on issues affecting the early childhood service delivery ecosystem, and to create change for children through the promotion of data and research. You are welcome all. So for those who might have missed it, I hope not. Last year we got the second iteration of the Thrive by 5 index. And as we continue to explore what the data gives us, we are beginning to see it has a lot to offer. And this morning we want to dig deep in the index from a different angle to what usually other researchers look at. So early learning, obviously, for all of us here who are deeply in the ecosystem in one form or another, we know that early learning is linked to better school readiness. It is also linked to stronger later performance, and it helps to lower repetition and dropout rates further on in the system. Yet, South Africa's early learning outcome remain uneven. So even with children who have access to this important good, are still not reaching, many of them are not reaching the expected milestones. And also we have a significant proportion of preschool age children who are not enrolled in early learning programs. So if those who are enrolled are not, many of them are not reaching the milestones that we expect them to have, and we have children who are not even in the system itself, you can imagine what that will mean for them and their readiness for formal schooling and later performance down the line. So this is exactly what we want to discuss and unpack this morning with our guest, Jesal. We want to explore how access to quality early learning can reduce developmental gaps that we are seeing in the system, and we hope to rectify by 2030. This morning's topic is labeled Cognitive Gains from Early Learning Enrollment, and we'll be focusing on 3 South African provinces. We have Jesal Kika-Mistry to help us to understand what is happening and what the data is telling us. Jesal is an economics PhD candidate with RESEP at Stellenbosch University. Her research focuses on understanding the barriers to and potential solutions for improving access, quality, and equity in the early childhood education in South Africa. She's also an economist and consultant with the World Bank's Southern and Eastern African education team, where she provides analytical, advisory, and operational support across the region and supports the bank's global investment in childcare initiative. Prior to joining the World Bank, she worked as a researcher in the Department of Basic Education and provided technical support on social sector policy issues to the National Planning Commission. So folks, we are in good hands this morning. Before she starts her presentation, a couple of housekeeping. Yes, to answer the question that will inevitably come up, we will share the recording and all related resources after the webinar, so worry not. Look out for it on our social media pages. That's our LinkedIn, and we will also send it through our newsletter. If you have any questions or comments to enrich this morning's discussion, please put it in the Q&A box so we do not miss it when the time comes to discuss, which will be after the presentation. We will also offer opportunity for folks to put up their hands to ask their questions or give substantive comments or input into the discussion after the presentation. With that housekeeping done, I welcome you, Jesal, to unpack this important conversation with us. Cognitive gains from early enrollment in 3 South African provinces. Welcome.
Thank you for the introduction, Elizabeth. I just want to share my presentation. Wonderful. Can you all see it? Great. Good morning, everyone. Before I begin, I'd like to thank Ilifa Labantwana, RESEP, and Data Drive 2030 for this opportunity, and particularly Data Drive 2030 for sharing the data on non-enrolled children with me before public release. So I'll phrase this a little differently from the title that Elizabeth shared, and the question that I'm essentially trying to answer here is, does enrollment in an early learning program improve children's cognitive outcomes? And this is evidence from 3 South African provinces. So a quick outline of this presentation today. I'll start with the motivation behind the study, giving you some context, what the evidence base tells us, and the research questions that I'll be answering. I'll talk a little bit about the data and the sample, and as Elizabeth said, that's a 2024 Thrive by 5 index. I'll also outline the methodology without going into too much technical detail. And when I present the results, I'll talk about the average enrollment effects, how this shows up by individual ELOM domains, and differences in these outcomes by different features of an early learning program. And then lastly, I'll wrap up by talking about some of the policy implications, but also some of the limitations of the study that we need to keep in mind. So on the motivation, and just to give you some context, so we all know that South Africa has made meaningful strides in expanding access to early learning programs, but nearly a third of 4-year-old children remain excluded from these programs. And this was analysis done by Catherine Hall using the 2024 GHS data. And then using a little older data, so the 2018 GHS, a colleague, Aldridge Moses, found that these non-enrolled children are disproportionately from poorer and more vulnerable households. And even though this is a little older, we don't expect that the situation would have changed much in the last 8 years or so. But as government starts advancing our 2030 strategy for early childhood development programs, and now focusing on implementing the Banapile shared blueprint, expanding access to quality programs is a central policy objective right now. So what does the literature tell us about this? First, we see that overall, there are these positive impacts in low and middle income countries. So center-based childcare is broadly associated with positive child development outcomes in these countries. And this literature was mainly based in Latin America and East Asia, and it was also just based on current levels of quality that the program was providing. We also see that the impacts vary at scale. So despite this overall positive trend that we see, the effects of large-scale expansion vary substantially across countries and across implementation contexts. So for example, in countries such as Brazil, we see improved child cognitive outcomes, but then in countries such as Colombia, for example, we see mixed results where nutrition outcomes improved, but actually cognitive outcomes didn't. We also see that there's domain-specific benefits. So enrollment may not affect all development domains equally, and benefits tend to accrue to mostly the higher order cognitive skills, or what we'd also call the school readiness skills. We also see that the equity effects are mixed. So programs are not consistently more or less beneficial for the poorest children. And here, for example, in low and middle income countries, larger impacts are observed for poorer children in some cases, but we also see big effects for wealthier children in these groups. So we're not sure who it's actually benefiting the most. Also, quality, we also see that quality is a critical moderator. So enrollment does not necessarily guarantee gains. So where program quality is low relative to the home counterfactual, so that means low relative to children who are actually staying at home, the developmental benefits of being enrolled in a program may be minimal. And lastly, the duration of enrollment matters, but only in quality settings. So longer exposure is often associated with stronger outcomes, but extended participation in low quality settings yields limited benefits. So what remains unclear in South Africa is, does enrollment in an early learning program itself improve children's cognitive development? And under what conditions do these benefits materialize? So I frame this separately as 3 research questions. The first is enrollment in an early learning program associated with measurable cognitive differences among children from disadvantaged backgrounds? The second is, how does the duration of enrollment relate to children's cognitive outcomes? And the third is, under what conditions do enrollment advantages emerge, and does program quality shape their magnitude? So now I'll talk a little bit about the data and the sample. So I used the 2024 Thrive by 5 Index, and the data on the enrolled sample, so children who are in an ELP, is nationally representative. And this covers about 5,001 children who are aged 50 to 59 months across 1,388 early learning programs. What was really interesting in this round of the survey is that there was a sample of non-enrolled children in the study. So these were purposefully selected, so they are not nationally representative. And we have about 272 children aged 50 to 59 months across 262 households. So some of the households may have had more than one child who was eligible. The instruments that were used in the 2024 Thrive by 5 Index was the ELOM 4 and 5 assessment, and this was used in both the enrolled and non-enrolled samples. There's also a primary caregiver interview, which covered 77% of the enrolled sample, but it also covered all non-enrolled children. And then for the children who were enrolled in an early learning program, there was also a learning program quality assessment tool, which I used to measure what I call instructional quality. And these children also had, the other instruments that were used was a facility observation form, a principal and practitioner interview. So the outcomes that were collected included measures on early learning, socio-emotional functioning, and physical growth for these children, but the focus of this study is purely on early learning, and this is the ELOM 4 and 5 assessment tool. So just to go into a little more detail about who this non-enrolled study sample was. So it covered 3 children in 3 provinces, Gauteng, KwaZulu-Natal, and the Western Cape. So Gauteng and KwaZulu-Natal were selected because they had the largest population of 3 to 5-year-old children, but they also have the highest absolute number of non-enrolled children. The Western Cape was mainly selected for logistical reasons. Children were also selected from the bottom 3 weighted school quintiles. So this was our proxy for disadvantage. And when I say weighted school quintiles, they were weighted based on the number of grade 3 learners in each school. So field workers actually visited 22,000 households, and the outcome was that we only had 272 eligible children. There were several challenges. It was difficult to verify non-enrollment. Some caregivers thought that it may affect the receipt of social grants. ELP participation is also highly fluid because of income shocks and caregiver availability. And there were also logistical and safety constraints for field workers in some high crime areas, also disruptions to the home. But essentially the eligibility criteria was households who had a child aged 50 to 59 months at the time of the survey, who were children who were not enrolled in any early learning program in 2024. And also that these children did not have any reported vision, hearing, or mobility difficulties, or any challenges understanding spoken language for the assessments. So again, each eligible child in this non-enrolled sample completed the ELOM 4 and 5 assessment, and their primary caregiver had completed the primary caregiver interview. So these figures might look familiar to those of you who have seen the results from the 2024 Thrive data. And the slide compares the ELOM outcomes between the enrolled sample, so that's our 5,001 children, and the non-enrolled sample, that's our 272 children. And there are headline figures from here that often get cited from this raw data. The first is that among enrolled children, about 42% of children are on track in the ELOM assessment, but 58% are falling behind. The second that gets cited is that among non-enrolled children, only 18% are on track, but 82% are far behind. And on the face of it, this looks like a clear enrollment advantage. But these are raw comparisons of the data, and I'll give you some reasons of why we cannot take this gap at face value. So the gap is clear, but we cannot say that enrollment alone caused this gap. So the first reason is that the 2 samples were collected differently. The enrolled sample was large and it was nationally representative. The non-enrolled sample was a lot smaller and it was very specifically targeted. The second reason is that the groups differ in ways that we can observe. So the enrolled and non-enrolled children differ on things that we can measure, such as their household backgrounds, their caregiver education, the learning support they have at home. And the raw differences between these 2 groups that we saw in the previous slide does not account for any of these differences. And the other reason is that there are these other differences that we cannot fully measure. So families who enroll their children may differ from those who do not in ways that we can't measure. And these differences can also affect children's development. So examples of this include caregiver motivation to send their children to an ELP, or their priorities, their time and work constraints, any family stress or stability in the home, the child's health, or access to other form of care, such as their grandparents, that we couldn't fully measure in this data. So I then tried a simple restriction to get a sample of enrolled children that look similar to this non-enrolled sample. So I restricted the enrolled sample to the same 3 provinces as the non-enrolled children. So that was KZN, Gauteng, and the Western Cape. And I also restricted it to children in these bottom 3 weighted quintiles. And in addition, because the primary caregiver interview was the only additional instrument that was administered to both the enrolled and non-enrolled children, and it provides key background information on the child's caregiver and household characteristics, I restricted the children who had completed primary caregiver interviews. So I end up with about 1,050 enrolled children in my sample, and these were across around 305 early learning programs. But when I tried to compare these children, so the 272 non-enrolled children and the 1,050 enrolled children, even after making sure that they're in the same provinces, they're in the same 3 bottom quintiles, they still look very different. So this table provides a snapshot of some of the key characteristics of enrolled and non-enrolled children. There are several other characteristics that I have not shown here. But even within this restriction, the enrolled and non-enrolled children are still very different. So if we look at the table, we see that the enrolled children tend to come from households with higher caregiver education, more paid work, they have more household assets, and more learning support in the home. And these differences matter because they may affect both whether a child is enrolled and how they perform on the ELOM assessment. So the raw gap that we saw earlier is not only about enrollment, it also reflects broader differences in children's home and background environments. And this is why we need to adjust for these observable differences before interpreting the enrollment gap. So now I'll talk you through a bit about the method behind what was done to understand this. And the question we want to ask here is, what would ELOM outcomes look like for non-enrolled children if they were enrolled in an early learning program? And to answer this, we tried to create a credible comparison by matching non-enrolled children to enrolled peers who are similar on key characteristics. So the previous slides showed that the enrolled and non-enrolled children differ in their background characteristics, so a simple comparison between the two groups will not be fair. So to make this comparison more credible, I use a matching approach called coarsened exact matching. So I won't go into too much detail about the method itself, but the idea behind it is quite straightforward. So I select key characteristics or matching variables, and where I find enrolled and non-enrolled children with similar profiles, I keep them in the analysis. Where I cannot find a good match, those children are left out from the analysis. I then compare the non-enrolled children with the enrolled children who have similar observable characteristics. But just to note that this does not solve everything that we're trying to figure out here. And matching only adjusts for things that we can measure. So there may still be these other differences between families, such as the motivation, stress, support networks, also beliefs about early learning that we do not fully observe. So the results that I interpret here should still be interpreted as associations, and it's not definite proof that enrollment caused the difference. So the next slide, I'll talk through some of the characteristics that I used for this matching process. So I matched on characteristics that are likely to matter for both whether a child is enrolled in an early learning program, but also for how they would perform on ELOM performance. So this includes a child's age, gender, province, and education level of the primary caregiver. So age matters because ELOM scores tend to increase quite quickly as children get older. And even we see this even within this narrow age range of 50 to 59 months. Gender is included to make sure we're comparing some children within similar groups. Province matters because access to early learning programs, service quality, and broader socioeconomic conditions within these provinces tend to differ. And caregiver education is especially important because it captures some of the longer-term differences in a household's background characteristics and the home learning environment. And I use caregiver education rather than caregiver employment for matching because it tends to be more stable. So employment can change over time, and it could also be affected by whether childcare is available to the household. So I did not match on every single possible difference that you saw in the table between the two groups, because if you match on too many characteristics, the groups become fragmented and we lose many of the children, especially the non-enrolled children, from the analysis. So I focused on a set of matching variables, and then I account for these additional factors such as the household assets, the language of assessment, what's the caregiver's relationship to the child, what are the home learning activities happening in the household, through the regression analysis, which I do after the matching. So what happened to my sample after matching? So before matching, we had 1,050 children, enrolled children and 272 non-enrolled children. After matching, we had all 272 non-enrolled children that are still kept in the analysis. And this is important because the non-enrolled sample is so small and we didn't want to lose these observations unnecessarily. What did change is that some of the enrolled children were dropped. The 59 shared profiles that you see here, and what this means is that there were 59 combinations of characteristics where we had both enrolled and non-enrolled children. So for example, a girl who is aged 50 to 52 months in KwaZulu-Natal, whose caregiver did not have a matric, would be one profile. So we had 59 combinations of these profiles. I'm now going to move on to some of the results. So I'll start off by looking at the average effects, and then I'll move on to what these results were by individual ELOM domain, and then I'll move on to what these differences look like relative to different program features of an early learning program. So after matching, I found that enrolled children score about 6 ELOM points higher than non-enrolled children. So this table shows the gap in total ELOM scores between non-enrolled and enrolled children. And because the comparison is written as non-enrolled minus enrolled, that's why we have negative numbers. And we see that non-enrolled children are scoring lower. So in the simplest matched comparison, or the baseline that you see in this table, non-enrolled children score about 6 ELOM points lower than the comparable enrolled children. I then further adjust for this step by step. I first include child characteristics, then I include the province, then I consider household socioeconomic and background characteristics, as well as the home learning environment. And the important point here is that the gap is still very similar across all of these versions. So it ranges from about 5.8 ELOM points to about 6.3 ELOM points. And this is roughly equivalent to about 5 to 6 months of typical development progress. So what we see here is that even after creating this fair comparison and accounting for several observable differences, enrolled children still score meaningfully higher than their comparable non-enrolled peers. So we also find that the largest gaps are in language, numeracy, and cognitive skills. So this slide looks at whether the overall ELOM gap is concentrated in particular ELOM domains, and the graph shows this adjusted gap between non-enrolled and enrolled children across each ELOM domain after matching them to children with similar profiles and adjusting for these observed differences that I mentioned. So this red line at 0 basically represents no difference between the two groups. And because all the estimates are to the left of this red line, it means that non-enrolled children score lower than comparable children, enrolled children in every domain. So the horizontal lines basically show us the uncertainty around each of the estimates. And in this case, the gaps do not cross over this red line, so they are all statistically significant. The largest gaps that we're seeing are in emergent literacy and language, cognition and executive functioning, and emergent numeracy and mathematics. And these are all equivalent to roughly between 7 to 8 months of typical development progress. The gaps in motor development, so fine motor coordination and visual motor integration and gross motor development, are smaller, but they are still around 3 to 3.5 months of development progress, and they are statistically significant. So what we see here is that enrolled children score higher across all these areas of development, but the largest differences are in the domains that are most closely linked to what we'd call structured early learning, sorry. So I then move on from this overall enrollment gap to asking whether the size of this gap differs depending on the type of ELP experience that children have. So in other words, we're not only asking whether enrolled children score higher than non-enrolled children, we're asking whether the gap looks different for children who have been enrolled for longer, children who are in registered compared to an unregistered program, children who are in subsidized programs, or children attending programs with different levels of infrastructure compliance, practitioner qualifications, and instructional quality. And these comparisons are important because enrollment is not a single uniform experience. Two children may both be enrolled, but they may be exposed to very different program conditions. So one may be in a program with stronger instructional quality, while another is in a program with weaker learning interactions. One may attend for fewer months, while another may have attended for 2 to 3 years. So a key point when doing this analysis is also that these are separate matched comparisons. So what I had done is I compared non-enrolled children to children in registered programs. Then I compared non-enrolled children to children in unregistered programs, and similarly across each of these categories. So again, this means that we need to think of these, in the interpretation of these results, as descriptive and not as formal tests of whether one category is necessarily better than the other category. So this slide looks at whether the enrollment gap differs depending on how long children have been enrolled in an early learning program. And the gap is larger when what we see is that this gap is larger when children have been enrolled for longer. When non-enrolled children are compared to children who have been enrolled for 0 to 12 months, the gap is equivalent to roughly 3 months of development progress. When they are compared to children enrolled for 13 to 24 months, the gap is larger at around 7 months. And then when they're compared to children who have been enrolled for 25 months or more, the gap is larger and roughly equivalent to a 9-month difference. So what we see is that the difference between enrolled and non-enrolled children appears larger when the comparison group has had more and sustained exposure to an early learning program. But again, we need to interpret this carefully. Like I said, they're separate match comparison within each duration group, and they do not prove that each additional month of enrollment directly causes higher scores. So it's basically that children who remain enrolled for longer may also, another thing to think about is children who are enrolled for longer may also differ in other ways. So for example, they may have better family stability, they may have better access, their parents could be able to afford these services, or their caregivers are also committed to keeping them enrolled. So again, we describe this as descriptive patterns where sustained participation is associated with larger differences relative to those who are not enrolled. So this slide compares non-enrolled children to enrolled children in early learning programs with different program features. And we see that across a range of program features, including registration status, subsidy receipt, infrastructure compliance, and practitioner qualifications, non-enrolled children score significantly lower than comparable enrolled peers. And larger advantages are generally found in the better resource setting. So as you'll see, fully registered, the gap is a little larger. Those that receive the subsidy, the gap is larger, with higher infrastructure compliance larger, and same with practitioner qualifications. But this pattern tends to change a little when we look at instructional quality. So in programs that are rated as having inadequate instructional quality, the gap between enrolled and non-enrolled children is a lot smaller, and the estimate is also less precise. You'll see that the line crosses this red line. But in contrast, children who are in programs with at least the basic level of instructional quality, the gap is much larger, and this gap is between 7 to 9 ELOM points. So this does not prove that there's one exact cutoff point at which these benefits begin. It also does not prove that instructional quality alone caused the difference, because these are separate match comparisons. But this pattern is still important. So it shows us that enrollment on its own may not be enough. And children appear to benefit more when enrollment is accompanied by at least a basic level of instructional quality, meaning that what happens inside the program matters, and it's not just whether the child is enrolled. So we'll quickly go through some of the policy implications and the study limitations. So the first is that what I found in this work is that access matters, but quality shapes the size of the gains. So non-enrolled children score about 5 to 6 months lower than their comparable enrolled peers, but the gaps are larger where instructional quality is at least at a basic level. So they may be in programs where structural quality is good, but if the instructional quality is inadequate, we won't be seeing a lot of these gaps. The second is that sustained participation should be supported. The enrollment gap is larger for children with longer exposure, especially those who are exposed for 2 or more years in an ELP. And lastly, quality improvements have to move beyond compliance. So the registration, subsidy access, infrastructure compliance, practitioner qualifications all matter, but children's daily experience depends on instructional practices and practitioner support and continuous quality improvements. So before closing, I just want to be a bit clear about how these results should be interpreted. So first, these are not causal estimates. I have made the comparisons much more credible by matching children with similar profiles and controlling for observable differences. But these children were not randomly assigned to enrollment and non-enrollment. So the results show these meaningful associations, but it's not definite proof that enrollment alone caused these gaps. Second is that the non-enrolled sample is very small and was collected in a very specific way. It's not nationally or provincially representative. So the findings should not be generalized to all non-enrolled children in the country, but we also cannot generalize it to each of the provinces that are part of the study. The third is that the matching helps us adjust for the differences that we can measure, such as age and province, caregiver education, the household's assets, their home learning activities. But there are still other family or community factors that we cannot fully observe. And lastly, the data captures children at one point in time. So we cannot compare children with different durations of enrollment, and we also cannot follow the same children over time to directly measure long-term effects. So with that, I'd like to close and thank you all for your time and patience, and we welcome any questions. Thanks.
Phew. Yeah. Thank you, Jesal. That was a lot. Very interesting findings as well. And I know your caveats are you're being cautious, but maybe I could be provocative and say where there's smoke, there's fire, right? So, yes, we are seeing results from some descriptives, and they are not causal, but I think they are also highlighting very important issues and gaps that we need to sort of apply ourselves to be able to close the developmental gaps to ensure equity towards where we are wanting to go. So thank you for that. Colleagues, I'll open it up for question and answers. If you have any substantive comment or contribution, any questions, you're welcome to indicate by raising your hand, and we will get our technical team to help us to unmute you to ask your questions. I've got a couple in this box here that maybe we can unpack. Whew, all right. So, lots of people are really interested in the quality aspect, but I'm assuming not structural quality, more process quality angle to it. So what indicators do you use to measure quality of education? So I'm assuming Katleho's question is alluding to quality of learning or the outcomes. So I think we've alluded to it in your presentation about ELOM, but perhaps there's a deeper explanation that will help. And then did you use the Thrive by 5 LPQA results to determine the instructional quality? So let's take those two together, and then we will give folks opportunity to also ask. Thank you, Jesal.
Thanks, colleagues. Thanks for the question. So the first one on quality. So two things. So in terms of children's outcomes, we use the early learning outcomes measure for 4 to 5-year-old children, which measures things like emergent literacy and language, emergent numeracy and mathematics, cognition and executive functioning, gross motor development, and fine motor coordination and visual motor integration. So it was the composite total score. So each of those domains are generally a score out of 20, and the total ELOM score here was out of 100. In terms of quality itself, so 2 parts. There was one part more around structural aspects, but there I looked at the registration status of an ELP, whether they received the subsidy, but separately I looked at infrastructure compliance. So I created an index with infrastructure variables from the survey. I also looked at the practitioner qualifications separately. And then in terms of process quality, so I termed it as instructional quality because that's what it essentially captures. I created a composite index as well, based on what was captured in the LPQA tool. So around teacher interactions, the learning environment, the relationships with the child, etc. I hope that that captures that. Thanks, Liz.
I hope so too. Colleagues, you're welcome to indicate if you have a question. I wonder if Liz Girdwood could, where are you, Liz? We want you to ask your second question. Go for it.
Can you hear me, Jesal?
Fantastic. Yes.
So essentially, I've got just a left field question for you, because you spoke about all the limitations of the non-enrolled sample. And I think someone's also commented in the comments about that as well. But if you were to repeat and improve on that sample of non-enrolled children, what would you recommend is done in another round of Thrive by 5?
Thanks, Liz. That is very left field and difficult to answer. And I think the data drive team will also talk about how difficult this was. The initial aim, I think, was around at least getting 540 children, non-enrolled children, and they only ended up with 272. I think Liz, it's such a tricky one. And, ideally, we'd like this to at least be provincially representative in the provinces that we're targeting. But it's so difficult to do. And, in some instances, I wonder whether, having a small component of this in the GHS could be a valuable starting point, and maybe asking, those families whose children are not enrolled certain questions. But I think this is really difficult. I think in KZN, the sample was so tiny. It was around 13 odd children in this group. So it's really hard for us to say a lot about what's going on. But I guess this is something we need to engage on a lot more to try to see how we can figure this out. Thanks, Liz.
And I'm going to be cheeky and ask Liz and Data Drive team to also consider the question you've just posed to Jesal now. I think what is important to note is that the unenrolled sample, that subsample provided very useful information, and it will be a great addition going forward. Despite the logistical nightmare it presented at some point, but that's something to also critically think around. I wonder if Andy Dowse, I hope I'm saying your name right, you could indicate yourself and then we will unmute you to ask your question, but we also accept all compliments and suggestion. And Andy's compliment, Jesal says, this is a brilliant presentation. I couldn't agree more. Folks, we have the full paper and the policy brief will be made available after the presentation as well. So please keep an eye out for that. It goes into more details. Andy, if we can find you.
Here I am.
Yes, go for it.
Firstly, well done again from me. My question really is, as you note, you can only analyze data that you have. So my question is really, from your experience and from the literature in this area, what other variables would you suggest Thrive by 5 team includes in the next round in order to explore critical predictors of ELOM that are currently missing in the 2024 data set? That is the question. I have one other comment while I'm talking, and that is I'm not sure that this is the best way to explore the comparison between enrolled and non-enrolled people in a national survey like this. My view is that, in fact, you need a more purpose-built study in which within an area, not across provinces and so on, you actually enroll kids from the same area in the study who are attending preschools and those who are not, and compare and randomly select both groups and then start doing your comparison that way. I think you might get more mileage out of it, but that's a comment to reflect on. Thanks very much indeed.
Thanks, Andy. And I just want to 100% agree with your second point, is that doing something like this is so difficult at a national level. So perhaps the next round, we just need to be a bit more intentional about getting groups of enrolled and non-enrolled children within certain areas or provinces. It might not be something that's easy for us to reflect nationally. But Andy, on your question around specific variables, I think the going through this data for the second time, I have worked on the 2021 Thrive by 5 data as well. And I think the variables that have been collected in this 2024 round are exceptionally thorough, and they've been so valuable. And one of the biggest contributions in this round, which I found beyond the non-enrolled study, is the inclusion of this primary caregiver interview, because now we know a lot more about who the children are, where they're coming from, what their household backgrounds are like, which we hadn't had any sight of in the previous round of the Thrive data. So I think for me, if we could continue with having such an important background questionnaire, it would be extremely valuable for the survey. Thanks, Andy.
Fantastic. So I wonder if Oneli Ngwedu, sorry for butchering your name if I'm saying it terribly wrong. If you can indicate yourself, and then we will give you an opportunity to ask your question. There's a really interesting comment here about the decision to exclude children with different disabilities. And I'm wondering, I mean, if we went to 3,000 households and we only found 272 non-enrolled children, I can imagine what the quest for finding children with different disabilities would look like. So to perhaps maybe answer or comment on that comment is that I think it's a matter of logistics and availability. We haven't even scratched the surface of getting all the access to the children that we require. So disability always is a bigger challenge, if I could put it that way. But that is just my my little contribution to that. And Nomdimiso says that it will be interesting to use same comparison indicators within the enrolled learners sample. I wonder. So maybe if you have a view on that, but let's take Onele's question and then we can address both of that together. Onele?
Thank you so much for allowing me to speak. Good morning, everyone. I just wanted to find out from you what inspired your study. What is the outcome that you're looking for? Or what did you see within within the population group you're looking at? Was it a gap in their development? Was it the quality of education they're receiving? What inspired you to have this research, or for this research topic to come about?
Thanks, Anele. So I brought this up in one of my initial slides, and part of it was this big push of we need to get children into ELPs, we need to get them registered, we need to expand access. And while that we know in the background that it's important, we still don't know enough about, is this access really making a difference? Or can we also reach children in different ways? So can we think about better home learning programs or parenting programs for younger age groups? Do we necessarily need like a brick and mortar early learning program with a practitioner? So the inspiration behind it was really just, listening to the push of expansion for early learning programs, but understanding like, are we pushing for something that's going to make a difference? And I think from the study, we see that it does make a difference, but now it's giving us a little bit more about how would it make a difference? What are the things that we need to make sure are in place to ensure that children are actually learning? So I hope that answers your question. Elizabeth, on the one around using the same comparators for the enrolled sample, I am a bit unclear about that. So if the person has a comment, they're welcome to ask the question.
So Nondumiso, if you are here, indicate yourself if you are willing to ask it live. It needs a better context than I can provide. I think the methodology of the paper itself, Jesal, is intriguing to most here. And I think it also offers other possibilities for the research to segue into different areas, depending on what people are interested in. And folks, again, I encourage you to look at the full paper once we share it. It goes into very detailed explanation that I think you'll find useful. I don't know if we found non-Dumiso yet. I can't see. Okay, so we will just leave that question as is until we have better context. I wonder if there are any other questions for Jesal on this specific issue. I can't see hands. Let me see. All right. So Jesal, we will let you breathe easy. It's been a really important and interesting conversation. I think the takeaway for me was, yes, enrollment does matter, right? Because we are not sure what is happening in the home environment. We cannot measure it, or we don't have access to that kind of information. And it is clear because the children who are not enrolled are coming from a really big deficit. So something clearly is not happening that should be happening in the home environment. And then the second takeaway for me is that even in the structured early learning space, just being there is not enough. What happens within that space is critical. And that goes to the space needs to be able to meet all the health and safety requirements to protect children. But critically, how the practitioners interact with the children is that key, or the gold standard, right? Is a thing that pushes what is happening in the space to where we want to be, to ensure that all children are ready for formal education and they're set up for life, to debut, to thrive, going forward into the education system. So that this has been a really engaging conversation, and folks are excited about the full paper. And for you as a homework to consider, soon to be Dr. Jesal, please think about the children with disability. I think this has been the biggest challenge for, even in the schooling system in itself. Children with disability are always sort of left behind or, forgotten. So let's see what we can do on that, in that area. Is that fair? So that we can invite you in future to speak to us about children with disabilities.
Thanks.
All right.
Thank you, everyone, for connecting to the session and for the engagement. I appreciate it.
All right. So thank you, colleagues. Join us again on the 1st of July. And next month, we want to look at exactly why so many children are not in early learning programs. What are some of the things that are keeping families from enrolling their children? And we're going to look at the affordability crisis within the sector itself and how that plays out in the conversation we've been having. If children, I don't think it's a decision where families are deciding, yeah, we don't feel like, sending our children to early learning programs. There are bigger and systematic factors that are driving that scenario, and we want to unpack it some more. So 1st of July, same place, same time. And thank you for spending an hour of your time with us. Have a good day further. Goodbye.